Of Dr.S.G.Mangalgi. This is my honor to welcome Dr.S.G.Mangalgi for your enlightening our vision. Please enlighten our vision through your concept, sir. Thank you. I request Dr. Muralidhar, sir, to escort to the session.
वागर्थाविव संपृक्तौ वागर्थ प्रतिपत्तये जगतः पितरौ वंदे पार्वती परमेश्वरौ. Respected chairperson of the session and my teacher, lots of senior teachers are here. Respected teachers and the audience. It is the most difficult task for me to present. Yes. To talk in the present session after a session on yoga. It is difficult because lots of things were placed. Ayurvedic doctors learn Ayurveda, practice modern system of medicine. That was one of the statements made in the previous session. But I say, as per my limitation, for last 34 years, I have been practicing only Ayurveda, not any other system of medicine. And most of my students, nearly 90% of students are practicing Ayurveda much better than me, what I am practicing today. That is, I feel very proud to say this. Regarding standard treatment guidelines, so there is a confusion. People think that if you go to an allopathic doctor, all the allopathic doctors prescribe the same medicine for a same disease. But when you visit Ayurvedic practitioners, they differ in the protocol of the treatment, and they differ because they think they may not be having any scientific basis for that. That may be the reason why they differ. That is what usually they think. And today, most of the insurance companies are not giving the reimbursement of Ayurvedic treatments because there are no standard treatment guidelines in Ayurveda. That is one more very important reason what has come to know. When I was working as a joint director, I had to face certain problems. A doctor from Public Health Foundation came to me and we wanted to develop standard treatment guidelines. I was just confused what they want from us, what really they need from us. Because always the standard treatment guidelines are there from time immemorial in Charaka Samhita or Sushruta or any other classical textbooks. But they are called as Chikitsa Sutras. So when we go back, look at this. See, these standard treatment guidelines, even they were there with traditional medical practitioners also. They were practicing. They had a standard protocol of the treatment. That is how it developed. Though we say Ayurveda, Brahma, Sutva, Yushovedam, Prajapati, Matigrath, etc., But when you read Ayurvedic textbooks, you will come to know that it is a science of observation, which has developed from day to day. And it is a thorough documentation of the practical experiences. That is what actually we observe. So likewise, next slide. Next. Say in Ayurveda, while explaining the treatment, Chikitsa of various diseases, Chikitsa Sutra are explained. These are the standard treatment protocols. And nobody will differ into this. All the Ayurvedic practitioners, if they are practicing Ayurveda, they use these treatment modalities. There may not be anything else than this. To substantiate this claim, the next slide. Next slide. Idam agama siddhatvat pratyaksha phaladarshanaat mantravat samprayoktavyam na mimamse katanchana. See, the beauty of this shloka, I have taken it from Ashtanga Hridaya Uttara Tantra, 81st shloka. So there he mentions, idam agama siddhatvat. The sages are practicing this. They have evolved this. And they are practicing this because pratyaksha phaladarshanat. They are yielding results. Without any results, they would not have practiced this. That is why today's practitioners are required to practice this without putting any question, without having any ambiguity. They have to practice like mantra. We may think that this version, there is no scope for this study in future because already everything is existing and we have to practice it. Next slide. Say in modern science, in modern era, everything is subjected to scrutiny and then validated. So we are unable to understand. Just in the previous session, they were telling that the things are told in Sutra Rupa. We are unable to understand them. But that is needed today, that they are to be validated. It is the subject to interrogation whether Chikitsa Sutras are only belief or facts which can be practiced in modern era. Say, if it were to be only belief, we would not have got the results. As they are facts, people come to us, they take the treatment, and we are practitioners today still practicing Ayurveda. Not all the Ayurvedic degree holders practice allopathic system of medicine. Most of us practice only Ayurveda because today the days are changed. People come to us for the treatment of Ayurveda. They want treatment from this particular science. And one of my patients was telling to me, sir, we have not come as an alternative science, alternative help from your side. We want primary treatment from you only. You need not think in that particular direction. That was the patient's version. Say, we get patients. Today, on priority basis, we get skin disorders. They do not even go to skin specialists. They come to us. Jaundice patients come to us. So many patients in this direction, they come to us. Why do they come to us? Because we are practicing Ayurveda. Unless we were practicing Ayurveda, they would not have come to us. And whatever we are practicing is from the text. We do not deviate at all as far as Chikitsa Sutras are concerned. But there may be difference in selectivity of the drugs. There may be selectivity because the standard treatment guidelines came to allopath's mind because there is polypharmacy. Polypharmacy means they prescribe many drugs for a single disease. Polypharmacy is existing. That is why they need standard treatment guidelines, what is first and what is next, they need it now. As they have polypharmacy. In Ayurveda, there is no polypharmacy as such. There is a standard. We have a particular selection, particular drug selected for a particular disease. So you ask any Ayurvedic student, what is the drug you are using in fever? Everybody will answer, they are using Amrita. Amrita means, say Guduchi, Amrita Balli, they are using it. In the similar manner, there is no ambiguity as such. But today we are required to show it to the modern scientific mind that whatever the sutras are there, they have the foundation. For this, next slide, we require the pathogenesis. Because we say that Samprapti-Vighatana is Chikitsa. That there are various definitions for the treatment, but the disintegration of the Samprapti itself is the treatment. Whatever is required for the disintegration of the Samprapti are there in Chikitsa Sutra. That is what is mentioned in Ayurvedic classics. Say here, in order to analyze and scientifically understand the principles of treatment mentioned in Ayurveda, if we do this, one would truly appreciate beyond doubt that Chikitsa Sutras are facts and not myths. It is not a myth at all. It is not only a belief. It is a fact. That is what I want to justify here all along, taking examples of few of the diseases. Say, next slide. The planning of the treatment in Ayurveda, it is specific. So determination. First of all, when we start with the treatment, we should apprise the patient whether it is curable or incurable. Sadhya sadhyata. We decide whether it is shodhana sadhya or shamana sadhya. We also decide that is whether it is easily curable or it requires some more particular methods. Always remember that the Chikitsa is of rogi purusha, not only roga. This is speciality of Ayurveda. We are treating the person, not the disease alone. We are treating the person with the disease, what he is suffering from. It is of rogi purusha. The treatment schedule not to be repeated. It is there in the classics. We do not repeat any treatment schedule. Strategic approach to be followed without compromising the principles of Chikitsa. The strategic approach to be followed without compromising the principles of Chikitsa. So we do not compromise. Make use of prepared medicines, always Siddha Yoga. So this is what is the planning of treatment. All Ayurvedic doctors, we plan in this direction. So we say that Purusham Viksha. Every individual we examine, we consider and then plan the treatment. Next slide. Of course, I think Baraha is not there. Baraha, Sanskrit is not there. Okay, no problem. You don't mind. So let me discuss few of the diseases. First of all, shvasa roga. It is a very common disorder, and most of the Ayurvedic practitioners are practicing very effectively in the context of shvasa roga. So there they mention Aktam Lavana Sailena Nadi Prastara Sankaraihi. So see the strategy here. Strategy here is the bronchodilation and expulsion of the mucus plugs, whatever are there. And this has to be maintained further also. So likewise, they have adopted this thing, this management, with the help of Snehana and Svedana. That is their approach, and Dhumapana also. Say likewise, what they have mentioned here, today also, the scientific world also treats any bronchial asthma patient in that particular direction. They use bronchodilators, they use mucolytic agents which liquefies the sputum, and mucokinetic drugs, which expectoration drugs. So all this methodology, the treatment schedule is there in Ayurvedic classics. Start with Aktam Lavana Tailena, Nadi Prastara Sankaraihi. Then they have mentioned if the patient is fit. Next slide. If the patient is fit, the treatment depending upon the constitution of the patients of shvasa roga. See here, none of the classics, any other medicine, branch of medicine discusses like this. Hikka shvasa mayi eko balavan durbalo aparaha kafadikas tatai veko ruksho bah anilo aparaha. See, these are the guidelines. This is the protocol. That is why the treatment differs from person to person in understanding these factors. That is, kafadike balasthecha vamanam savirechanam. Then, kuryat pathyashino dhumalehadi shamanam tataha. Dhumalehadi shamanam tataha. Se kafadike balasthecha vamanam cha savirechanam. See here, if the patient has got more sputa, more predominant of kapha dosha, make use of vamana and virechana. If at all he is strong, able to sustain that particular line of treatment. Kasine chardanam dadyat swarabhangetu muddhiman vataskleshma harayiryuktam tamaketu virechanam. These are the principles. We practically practice these principles. So you ask any Ayurvedic doctor, go and ask any Ayurvedic doctor, what is the Shodhana Chikitsa you are adopting in bronchial asthma? He will tell virechana only. He will not tell any other thing, and they are practicing it, and it is proved worthy also. And at the same time, we practice Vamana Karma. So this Vamana, what we are mentioning is, we have done a lot of study on this particular factor also. Adopting Vamana and Kunjari according to naturopathy, we studied comparatively. So this stimulates, this vomiting center, when it is stimulated, it has got a best expectorative action also. Likewise, then these are the principles. Et kinchit kapha vatagnam, ushnam vatanulomanam, beshajam panam annam va tadhitam shvasahikine. This is the protocol, treatment protocol which we adopt. Say in the modern science, for the relief of an attack, immediate bronchial attack, they are using the inhalers or the nebulization methods. We tried an Ayurvedic drug also in the similar manner. By the nebulization method, the concept is from Ayurveda. The concept is from Ayurveda only. It is not anybody else's concept. We tried in the nebulization method the bharangi, the aqueous extract of bharangi, it yielded results. So earlier days they were using dhumapana, that is they were delivering the drug to the target organ. That was the concept, that was the strategy. And we practiced in the similar manner. Say modern science, they are using a technique of nebulization. They deliver the drug to the target organ. In the similar manner, we did it. We did a study also on this, and it proved to be effective. But what is lacking here is, we need a lot of experience in treating status asthmaticus. Today, modern science is using the alkaloids and the extracts of the drugs, and they are more effective than the crude forms what we are using. But we have to develop it. The strategy is same, but we have not done any further work on that. That is the tragedy of it. Otherwise, say we tried with Dhatura Dhumapana only, Dhatura Bija Dhumapana in one of the research works we did it, and it yielded results. In mild to moderate bronchial asthma, it gave immediate results. So likewise, this is one disease example I am giving. A few more diseases I will be giving the example. Next slide. Doshanusara specific treatment also is being mentioned. So all these quotations I have placed because There is a direction in the classics. There is a direction. Vata krudva kafaharam kafa krudva anilapaham karyam naikantikam tabhyam prayaha shreyo anilapaham. See, they particularly stressed on the point that bronchodilation is the most important thing. Prayaha shreyo anilapaham. What they wanted, definitely they have impressed in these particular points. Say, Sarvenam Brumhanam Yalpaha Shakyascha Prayasho Bhavet Natyartham Shamane Apayo Brusho Ashakyascha Karshane. See, always maintain the strength of the patient, any bronchial asthma patient. Likewise, in classics, we get all this information. And this information is particularly helpful. We have to develop it now. We have developed so many things in the Mysore College postgraduate department, making use of these principles only. We have not deviated any strategic approach what is mentioned in the classics. The strategic approach has remained the same. Next slide. See, one more important disorder, that is jaundice. Treating jaundice is an important factor. Of course, those shlokas are not available here, but the main important thing is you can go for the source. Not possible. Say in jaundice, we say there are much earlier, during Charaka period itself, he understood two types of jaundice. Koshta Shakashrita Kamala and Shakashrita Kamala. Pandurogo yo atyartham pittalani nishevate, then he started. That is, prehepatic jaundice was explained during Charaka's period. Why I am telling this particular reference is, they have understood. We know they thought in this particular direction. All along the treatment of Koshta Shakashrita Kamala, he has mentioned two important factors. One is you should take care of Pandu, anemia. Second thing is you should do Pittanashaka Chikitsa, and whatever the treatment is mentioned in the classics. So the Virechana is the line of treatment, and that too after Snehana. Snehana, Abhyantara Snehana, and then Virechana. That is the line of treatment. See, this particular disease I placed in front of you because they had this concept. Today, what the modern science is speaking, that is prehepatic, hepatic, and posthepatic jaundice. Prehepatic jaundice was mentioned much before during Charaka's period. And the line of treatment was also being mentioned in that particular period. Next slide. Next. Next. Say, next, you can go. See, I'm giving one more very important good example of very good disease. Say Udara disease. Udara, particularly the ascites. Whatever may be the cause of the ascites, but the treatment is one and the same. Apam dosha haranyado pradadyad udukodare mutra yuktani tikshani vivida ksaravanti cha deepaniyaha kafagnaischa tamahurai rupachare. Say, please remember here, apam dosha haranyado. Today also the same line of treatment is existing. Modern medicine, whatever may be the cause, they want to eliminate the fluid which is collected. That is the approach. And this approach, this strategy was mentioned way back. And while explaining the treatment of Udara Roga, they mention why Virechana is given in Udara. Because doshoti matropachaya, say, apam doshaharanyado pradadyad udakodare mutrayuktani tikshani vividan ksaravanticha. How it should be given? Say, today no practitioner, except Ayurvedic practitioner, will use mutra as a diuretic or a virechana agent. We use gomutra haritiki in particular. Why use? This is the strategy. We do not deviate from this. In the similar manner, doshoti matropachayat sroto rodha nirodhanat sambhavanti udaram tasmat nityamenam vireche. Every day the virechana is being adopted. Why everyday virechana is given? In the same shloka they have mentioned the reasons behind that. Doshoti matropachayat, as there is provocation of doshas more, and as there is sroto rodha. That is why you have to make use of virechana drugs. That is the strategic approach. Here, one important factor to be stressed is the disintegration of Samprapti I told in the beginning itself is Chikitsa. Samprapti-Vighatana meva Chikitsa. All these Chikitsa sutras aim at the disintegration of the Samprapti only. And the similar methods are explained in all the diseases, not one disease. Next slide. So, Kushtha Chikitsa, it is one more important factor. I think I cannot explain all these things in a given half an hour time. Next slide. Previous one. Previous slide only. No. Previous slide. Yes. Pakshat shardhanan nyapadaye masan samsanam chapideyam. Say once in every 15 days in Kushtha disorder, the Vamana has to be done. Once in a month, Virechana has to be done. In the similar manner, once in 6 months, Raktamokshana has to be done. Once in 3 days, Nasya has to be done. That is the Chikitsa Sutra. In the beginning itself, it mentions, Tatra purva rupe ubhayataha samshodhanam masevet. If you observe the prodromal symptoms of Kushtha disorder, Kushtha means skin disorders, not leprosy here. You have to do Ubhayataha Shodhana, Vamana and Virechana. One of the students came to me and I want to do work on this particular thing. That is Pakshat, Vamana and Masat Samsana, that is Virechana Karma. And practically it was being done. Every 15 days Vamana was given. And a patient who was 20 years suffering from psoriasis, who was a teacher at St. John's Primary School in Mysore, got relieved totally by giving Vamana Karma. That is the classical reference. We adopted once in 15 days. We adjusted, say, first 7 days. You have to give Arohana Snehapana, Shodhananga Sneha. Then afterwards, 8th day, Vishramadina. Then on 9th day, we used to conduct Vamana. His doubt was how to conduct next Vamana. Because in Charaka Samhita, there is a reference that minimum 3 days of Snehana is sufficient for conducting any Shodhana procedure. That with the help of that particular reference, we started once again this Snehapana on 11, 12 and 13 days. 14th day was Vishramadina and 15th day we conducted Vamana, not in one patient. Please remember, more than 25 patients, 25 to 30 patients he did in his particular work, and totally 100 psoriasis patients were treated during that time, making use of, and they had excellent result. That is why we are practicing today. If any psoriasis patient comes to us, they come in search of Ayurvedic doctors. They do not go to modern practitioners. There, the treatment modality is very difficult. In one of the patients, they were using anti-cancerous drug also, methotrexate. We stopped the drug after some time, after starting our therapy. Later on, this method was adopted. that is a severe hepatotoxic drug. And this method was adopted and patients became all right. This is how the strategic approach of a particular disease can be developed. Most important disease, most common disease, and most controversial in Ayurvedic practitioners is fever, jvara. So next slide. Say, sir, you are telling that in jvara, langanam, swedanam, kalo, yavagvas, tiktako, rasaha, if we ask the patient to do langhana, how the patients will come to us afterwards? One thing, please remember, we are fortunate Ayurvedic practitioners because patients on first or second day of fever will not come to us. First and second day or third day of their occurrence of fever will not come to us. They come to us only when they do not get relief from the modern medicine science. We have treated certain fevers also in that particular direction. They call it as pyrexia unknown origin. But the treatment methodology was followed Ayurvedic method. So, author, this I have particularly placed. This because he mentions why we are adopting Langhana, because Amashayasto Hatvagnim Samo Margan Pidayat Vidadati Joram Tasmat Langhana Me Vacharet. Amasha, next slide. He mentions Langhanam Svedanam Kalo, Yavagvas Tiktako Rosaha, Pachanani Vipak. Please remember, I used to teach students, don't interfere in the pathogenesis of fever. Don't start with antibiotics or don't give antipyretic drugs unless it is required. You are doing two mistakes if you do this. If you start antibiotics, what happens? The diagnosis is not established. If you give antipyretic drugs, you will not come to know what is the type of the fever the patient is suffering from. That is why they have mentioned in the classics, Kala. Kala means you have to wait for certain duration. They have thought, judiciously they have thought, may not be this strategy may not be liked by many people in the present days, but it is a strategy. We have to wait for 7 days. I ask questions. I ask the present day students also, how many of you have seen the clinical presentation of typhoid fever today? None of the students raises their hand. But when we were students, we used to see number of patients of typhoid fever, because then they were not using, like now, any antibiotics unless the diagnosis was established. They were giving respect to this Kala also. Step ladder type of increase of temperature, the petechial spots over the abdomen, etc. None of the students have seen today. This is because not that the typhoid is eradicated. This is because we are not allowing the patients. We do not clinically observe these factors. The patient is covered as a practitioner, any allopathic practitioner or an Ayurvedic practitioner practicing in villages. They put him on the cover of antibiotics. There we really commit the mistake. So you could have waited for some time. That is the condition. Say in fever, next slide. In fever, he has substantiated for everything. Why Langana has to be done, where Langana should not be done, when Svedana to be adopted, why Svedana has to be done. Say, if you look at the Jvara Samprapti, Sansrushtaha, Sannipatitaha, Prutagva, Kupita Malaha, Rasakhyam Dhatu Manvetya, Paktisthana Niresya, Rasas Vedavahani, the particular srotasis, he mentions the heat is not lost by the perspiration in case of fever. That is why they have asked to do Svedana Karma. Svedana Karma by the various methods explained in the classics, or else by making use of certain drugs. We use Vatsanabi for that particular purpose, and it gives immediate relief also. So likewise, every Chikitsa principle, if I go on explaining, most of the diseases have a basis. The principles are based upon the strategy to disintegrate the Samprapti of that particular disorder. That is why there is a notion in the public that Ayurveda cures from the root. That is a notion. But in Ayurveda they have told most of the diseases are incurable. They cannot be cured. You have to make use of the medicines and change in lifestyle as long as the disease exists. The disease exists forever. We call them as yape rogas. We cannot do any false claim. But we can do so many things, so many factors can be done by making use of the Samprapti available and studying Samprapti under the light of modern pathology, and then understanding the principles of Chikitsa to be adopted. Next slide. Next. It is an empty slide. Yes, I have kept empty slide because I am not ending here. It is continuing. This process, this discussion is continuing. Always it is, there is no end to this. We say this is a particular line of treatment, and somebody else in Ayurveda say that whatever you are doing may be right to your thinking. But another strategy can also be adopted. But audience, please think that there is no polypharmacy in Ayurveda. There is no polypharmacy. We use particular drugs. Ask any Ayurvedic student or any Ayurvedic practitioner what you are using in Vatarakta, that is gout. All of them will tell only one drug, Kaishorugugula or Amritarishta. This is because they are time-honored prescriptions. Time-honored, and they are used in particular. These drugs are used in particular condition. To conclude this, it remembers me of my student days. When I was student, I was asked by sir to take one particular subject, that is Abhyantara Snehapana with special reference to Virechana. It was insisted on me. He insisted particularly on me that you do this work. Actually, I was taken back. Whether during those days in 1970s, it was not generally practiced. It was not generally practiced. Cures from the root. That is a notion. But in Ayurveda, they have told most of the diseases are incurable. They cannot be cured. You have to make use of the medicines and change in lifestyle as long as the disease exists. The disease exists forever. We call them as yape rogas. We cannot do any false claim. But we can do so many things, so many factors can be done by making use of the Samprapti available and studying Samprapti under the light of modern pathology, and then understanding the principles of Chikitsa to be adopted. Next slide. Next. It is an empty slide. Yes, I have kept empty slide because I am not ending here. It is continuing. This process, this discussion is continuing. Always it is, there is no end to this. We say this is a particular line of treatment, and somebody else in Ayurveda say that whatever you are doing may be right to your thinking. But another strategy can also be adopted. But audience, please think that there is no polypharmacy in Ayurveda. There is no polypharmacy. We use particular drugs. Ask any Ayurvedic student or any Ayurvedic practitioner what you are using in Vata Rakta, that is gout. All of them will tell only one drug, Kaishara Gugula or Amritarishta. This is because they are time-honored prescriptions. Time-honored, and they are used in particular. These drugs are used in particular condition. To conclude this, it remembers me of my student days. When I was student, I was asked by sir to take one particular subject, that is Abhyantara Snehapana with special reference to Virechana. It was insisted on me. He insisted particularly on me that you do this work. Actually, I was taken back. Whether during those days in 1970s, it was not generally practiced. It was not generally practiced. During those days, the professors from medical college were also attending our Ayurvedic college, and they were teaching us also. The professor, Ramchandra, I still remember his name, he came to know about my subject, and he told that, doctor, you just collect the samples, blood samples of your patients who are taking Snehapana from the first day of Snehapana, and after the completion of Snehapana, you just collect the samples and give me. And after the study was over, he came out with such a information that we were astonished that it has got a hypolipidemic action, hypocholesteremic action. He studied only on cholesterol, and Abhyantara Snehapana, though we were giving Nandini ghee, it reduced the cholesterol. That was his observation during those days in 1970s. See how this was being practiced. Then a friend of mine came from CFTRI. He was doing his PhD work on Snehapana, and he came to me and discussed with myself and Dr. Anjaney Murthy regarding this. And he told that, doctor, whatever you are doing, you tell me. I want to do an animal experimentation. So he fed the animals the ghrita, what we were giving, and it was observed that it has got a hypolipidemic action in the animals also. And later on, he told that I will do in patients, your patients, and we will have a control group of 10 normal individuals and 10 hyperlipidemic individuals. We did it. To his astonishment, he observed that in normal individuals, it didn't have any action. Patient didn't had increase of cholesterol or triglycerides, etc. But patients with hyperlipidemia, they had hypolipidemic action. It was observed by him, and he came out with a theory that 2.5 grams of ghee per kg body weight in humans has got a hypolipidemic action, and minimum it has to be given for 3 days. That is told in Charak Samhita. This is the observation made by the particular researcher. His name is Dr. Vijay Kumar. Now he is in States. And the paper was published by his guide, Dr. Lokesh, I remember, in National Dairy Journal. And he had a lot of protest for the publication of that particular paper. How do you say that ghee has got a hypolipidemic action? And he studied on so many factors. why he is more effective in psoriatic patients as such. So, why I told this at the conclusion is, we will come to know when we start practicing, and we will have an insight. Say, this work, what he did, Dr. Vijay Kumar helped us a lot. Based upon that, we are practicing today with the information and which coincides with Chark Samhita. Minimum 3 days he tells, it has to be given minimum 3 days. Unless you give less, it does not have the action. And he has done so many other works also. Brahmana Sneha, etc. We explained him, but there is no time, that's why I am not going into those details. But however, the strategies mentioned in the classics are to be understood. We do not require any scientific validation, but we have to understand them. The scientific understanding is necessary, not the validation. We are very small individuals. We are not learned to the extent of Charaka or Sushruta to validate their findings. We are just, I feel, at the age of 62, I am just beginner in Ayurveda in various aspects. So with these few things, if at all I have inspired the doctors to practice Ayurveda, the young generation, I think I have fulfilled the work. And there are a lot of things, and we have gurus like Dr. Gopinath, Dr. Krishnamurti, who are sitting in front of us, who would definitely guide, and colleagues who are here, they will definitely help. Dr. Aruna, Dr. Savitri, Dr. Murlidhar, all of them will help us. And most of the information I have taken from Fundamentals of Chikitsa, Volume 2, Volume 1, written by Dr. Aruna to explain. She has explained all these factors in that particular book, how strategically these principles are helping. I thank the organizers for giving me an opportunity to share the views, and at the same time,